The medical groups pushing back on the Trump administration, claiming the use of Tylenol during pregnancy may be linked to an increased risk of autism. Here are the experts and organizations as of right now that are coming out against the administration's guidance. Our chief medical correspondent, Dr. Tara Narula, is standing by for us. But first, senior national correspondent Steve Osunsami has the latest. Good morning, Steve.
Good morning to you, Michael. With this announcement, the president is widening the gap between established science and what the government is telling pregnant women. The FDA is now planning on adding a warning to bottles of Tylenol, and they're telling doctors to warn their patients.
Don't take Tylenol. Don't take it. If you just can't, I mean, it's just fight like hell not to take it.
There's a strong response this morning from major medical groups that are taking issue with the White House's announcement tying autism to women using Tylenol during pregnancy.
First, effective immediately, the FDA will be notifying physicians that the use of well, let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good.
President Trump's messaging came with his health secretary, RFK Jr., by his side, who has long shared provably wrong theories about what causes autism.
They are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think.
This morning, major medical organizations are disagreeing with the president, saying that acetaminophen is safe for pregnant women and that the drug is important because untreated fevers can end pregnancies. The makers of Tylenol say that sound science clearly shows that taking acetaminophen does not cause autism. The president also claims that ingredients in vaccines and the close timing of childhood vaccinations could also be contributing to rising autism cases. The FDA commissioner standing by the White House's claims on Tylenol.
Acetaminophen has been given willy-nilly, way too frequently, without any discussion of the potential risks to balance out those discussions about the potential benefit.
But medical groups say that there have been dozens of large studies over the decades, and not one of them found that acetaminophen or vaccines cause autism.
There was a study that was done in Sweden where they looked over a 25-year period at 2.5 million children to see whether or not Tylenol taken during pregnancy increased the risk of autism. And it didn't. And more importantly, they did it the right way because they did the so-called sibling control. So they looked at mothers who took Tylenol during one pregnancy but not another. So you could compare those two pregnancies. And again, it found that there was no relationship between taking Tylenol and developing autism.
Dr. Edith Bracho Sanchez is a New York pediatrician who is pregnant with her second child and shares that she's still taking the drug herself.
Uncontrolled fevers in pregnancy pose an increased risk of miscarriage, of neural developmental defects. Knowing what I know about the risks of Tylenol in pregnancy versus the risks of an uncontrolled fever, I would take Tylenol again in this pregnancy.
The stock price of Tylenol has fallen dramatically because all of this. And Tylenol is a very important drug for pregnant women because they are not encouraged to take that other popular painkiller, ibuprofen, because that one, for certain, increases the risk of miscarriage. Guys.
That we know. All right, Steve, thank you. We're going to bring in ABC News chief medical correspondent, Dr. Tara Narula. So can you just help us have a better understanding of this?
All right, so there's a few things to cover here. First of all, autism, there is not one single cause for autism. We know that it is a complex disorder characterized by hundreds of genes, different environmental influences, and part of the reason, Robin, why we have seen these rising numbers that President Trump alluded to is because we are screening more, is because we changed the diagnostic criteria. It's important to look for environmental influences, and researchers have tried to look back over the last decade to see, is there an association between Tylenol and neurodevelopmental disorders. The research has come down on both sides. There is research, as you heard in the piece, from Sweden. That was the largest study that shows there was not an association. And there are other studies that do the same. There was just a research study a few months ago out of Mount Sinai and Harvard that did show there was an association. And so really the research at this point is inconclusive. That's one thing. The second thing is that association is not causation. That's a really important point. So when we look at an association, it could be that the women who took Tylenol, the reason we saw that link, so to speak, was not because of the Tylenol. It was because of the fever that they took the Tylenol for, or the chronic pain condition, or the infection, or maybe they were taking some other medication. It's very hard to tease that out. So really important. But there is a biology there that does make sense. We know Tylenol crosses the placenta. It can cause stress on cells. It can disrupt hormones. Sure. So there is a plausible explanation as well.
So
on the other side.
if you are pregnant, what do you do at this point? And if you're unsure, is there an alternative to treating pain or fever?
Right. So this is a very nuanced discussion. It's not as simple as don't take Tylenol, I think, as we heard the president say. And women really should be speaking to their doctors at this point about making an informed, individualized decision. And really, like any medication, it comes down to weighing the risks and the benefits. So for some women, it may be, I don't want to take it if I have a headache, or maybe I want to take the lowest dose for the shortest time. And some women may not change their practice. It is important to point out that groups like American College of OBGYNs and Maternal Society of Fetal Medicine still support Tylenol as safe. And contrary to what the president said, there is a downside to not treating fever and pain in pregnancy, which is preterm birth, birth defects, miscarriage, maternal anxiety and depression, and high blood pressure.
The administration has also announced that it's starting an approval process for this drug called leucovorin.
Right.
Tell us about that.
Leucovorin is a currently used drug. It's a derivative of vitamin B9 or folate that we use to treat the side effects of chemotherapy. We know that it's important in some cases for certain types of autism. We have seen benefits in terms of getting folate into the brain. So for certain kids with ASD, it may be beneficial. It's not a cure. It's not for every person with autism.
Dr. Narula, thanks very much.